Hi, I'm Amy Zabin. It's great to be back again with you, Dr. Joe.
Absolutely, Joe Feuerstein. Nice to meet you. Nice to see you again. So the study today is a study that actually came out this week, and it is published in the Journal of Endocrinology and Metabolism, which is a very well-known endocrinology journal. What it's looking at is the association between different types of sleep patterns and risk of developing diabetes or something called impaired fasting glucose metabolic syndrome. In other words, problems with your metabolism depending upon whether you sleep in one way or another. And the two ways that people classically are divided is morning larks, who basically go to sleep early and get up early, versus the night owls. And night owls obviously stay to sleep. They go to sleep much later. They have a harder time getting up in the morning. So what they did in the study is that they took about 1,600 Korean middle-aged adults. These people were in their late 40s to late 50s, and they followed them for literally about 14 years. They did a 19-question questionnaire to decide whether you were a morning lark or you were a night owl, exactly. And what they found following them and then looking at their blood cholesterol and, more importantly, their fat and their blood sugar and their smoking status and their exercise rate of exercise, what they found is that if you were a night owl, you had a 70% increased risk of developing diabetes.
70%.
70%
Wow.
increased risk compared to someone who was a morning lark. And they had a couple of theories as to why that would be the case. One of which is that, why are people night owls? Well, modern technology, television, the little screens, the internet are all essentially disrupting our normal sleep pattern. Melatonin, the hormone that we talk about sometimes that is the sleep hormone, is very dependent upon ambient light. If you are watching a small TV or you're watching the computer or something, you are actually disrupting the normal rhythm of melatonin, and that'll make you go to sleep later. So what they found is that in women, the women who were night owls, they had an increased risk of diabetes, and they were also more likely to be smokers. The men, it was actually slightly different. They had an increased risk of not diabetes, but metabolic syndrome. That's increased weight, increased sugar, low good cholesterol, high triglycerides, but also they had an increased risk of being much less muscle and much more fat.
What a complex issue to look at. And 14 years is a very long study. But it kind of goes back to the old adage that early bird gets the worm and not diabetes.
That's exactly right.
The early bird has a healthier start.
So what they are thinking about is something we should be looking at and asking ourselves is, are you a morning lark or a night owl? And if you're a night owl, are you a night owl because you have bad sleep hygiene? And if you do, that comes with a risk: diabetes, metabolic syndrome, weight gain, and less muscle mass.
Absolutely. So now that spring is here, it's time to really spring forward and get ourselves on a better clock.
Absolutely. Thanks, Amy.
Thank you.
Bye-bye.